Hello everyone, welcome to TanuWellness, where we break down the complexity of physiotherapy one topic at a time. Today, we're going to dive into the topic of sciatica, a term that is frequently used but rarely understood. I'm sure many of you must have heard about it or maybe experienced the symptoms. In this video, we will look at what sciatica really is, how it affects our daily lives, and why understanding it is so important. So stay tuned as we explore the complexities of this often misunderstood condition. We'll cover everything in the following few minutes, including the anatomy of sciatica nerve, how to differentiate it from other back pain conditions, and also we'll talk about some typical triggers and clinical relevance of this condition. Here's the catch: not all back pain is caused by sciatica. Stay tuned to learn more about this fascinating subject. If you are keen on learning more about physiotherapy and staying on top of your health, don't forget to hit that subscribe button. We share new, insightful content regularly just for you. Now, let's break down the basics of sciatica using a simple analogy. Think of sciatica like a garden hose running through your backyard. This hose runs right from your lower back to your hip, buttocks, and extends to your each leg. Now just imagine this hose gets kinked in one particular point, exactly like the pinch in your sciatica nerve. Now, when you sit for prolonged hours and you try to stand and walk, then is the time when you have a sharp, intense shooting kind of pain, which runs down from your back to your leg and even sometimes to the foot. This is typically on one side of your leg. Despite seeming like a pain issue, sciatica can greatly impact your life, turning normal activities like sitting, standing, or walking into difficult challenges. Now let's try to understand the location and path of sciatica nerve. So when you say you have sciatica condition, basically it means you have inflamed or irritated sciatica nerve. This nerve is the largest and the longest nerve in your lower body. It starts, like I told you initially, it starts from your back and goes till your leg. And there could be various reasons like, slip disc, it could be stenosis, spinal stenosis, which pinches or compresses the sciatica nerve. Sometimes it could be as simple as the muscle spasm. There's a muscle known as piriformis. When this muscle gets completely compressed, or when you're sitting for prolonged hours on that particular nerve, it gets inflamed. So now the location and path of this nerve explains why sciatica pain is widespread, affecting a large area from your back down to your feet. Understanding this helps in visualizing why the pain occurs in these specific reasons and why it might vary in intensity or type. If you have had experiences with sciatica or any questions, feel free to share them in the comments below. We love hearing from you, and your insights add great value to our community. Don't forget, there's a special bonus at the end of this video where I'll be sharing some key tips on identifying sciatica. You don't want to miss this, so keep watching. There are a few indicators which will help in distinguishing between sciatica and back pain. First of all, sciatica usually begins with lower back pain and sometimes even buttock discomfort. That might travel from your lower back to sometimes to your knee or sometimes to your foot. The fact that certain movements such as sitting, standing, coughing make this pain worse is worth noteworthy. The following advice relates to clinical diagnosis. Keep an eye out on any muscle weakness, numbness, or even tingling in your foot. These indicate a possible problem with sciatica nerve. Additionally, observe whether the discomfort gets worse while you lie down or even you bend your body at the waist. These quick tests can assist in distinguishing sciatica from other types of back pain. However, in order to receive a precise diagnosis and rule out other potential explanations, you need to speak to your medical specialist. Let's discuss what causes sciatica. This condition can be caused by a variety of circumstances. So today we'll discuss 4 conditions. First cause is slip disc, which is a very common cause, also known as a herniated disc. This puts pressure on the nerve, making it inflamed and causing sciatica. Second is spinal stenosis. This is narrowing of the spine. The nerve is here. So when it completely narrows, it causes inflammation of sciatica, causing sciatica. Now, third is spondylolisthesis. It might sound a little complicated, but it's very easy to understand. There are 2 vertebrae. So one, when the vertebra moves forward, it compresses the nerve. And fourth condition is piriformis syndrome. Again, it sounds complicated. It's easy to understand. There's a muscle known as piriformis. When this piriformis muscle compresses the sciatica, it inflames it, causing sciatica. And there are certain risk factors like being obese, or you have a history of heavy lifting, or for the ladies, if you're wearing heels regularly, or you have a sedentary lifestyle. All are these risk factors which causes sciatica. Sciatica condition is clinically significant since it has the potential to reduce your quality of life. It may restrict mobility, making it difficult to stand or walk. Some people have excruciating kind of pain that interferes with their ability to do daily activities. Sciatica is also prone to reoccurrence. That means if you had once, it might even return. In severe situations, it might damage your nerve and also completely reduce your muscular strength. So early diagnosis and treatment are critical to properly controlling sciatica and avoiding long-term consequences. 1. Knee to chest. In this, you will be lying down. Pull your knee closer to chest. Hold for 10 seconds and gently release. Do it on the other side. Hold for 10 seconds. It's like hugging your knee and release. 2. Pelvic tilt. Same position. If needed, if you have back pain, support your back. Contract your abs up and down. Up and down. This can be done this way so that you can feel your abs. Now, third is in sitting position. So whenever you release, always roll on one side and release. The third is seated spinal stretch. Keep your one leg straight, cross the other side, push with the opposite elbow and feel the stretch. Here. You should feel this whole part getting stretched. Hold for 10 seconds and release. Remember to go slow and gentle. And remember, if you are feeling any kind of pain doing these movements, stop there and consult a physiotherapist for personalized advice. Thank you for watching. If you have liked these exercises, do like, subscribe, and share with the people who might need these exercises. Thank you for watching. Until next time, stay healthy and be happy.